on to the second half of my elective. So I left India and I flew to a place called Tabubal in the western province of PNG. So you can see Tabubal up here. And this is located very close to the Oktedi mine. Many of you might have heard of the Oktedi. Yeah. Tabubal actually exists to provide labour to the Oktedi mine. So it's relatively well developed, and the hospital is actually a referral centre for much of the area. This is an idea of the country. This is the Oktedi River you can see in the background, and the mine's up in behind these hills up here. Very rugged, remote jungle. We were flying over jungle for about 2 hours. This is a picture of the Tabubal Hospital. So it was about a 50-bed hospital, and there were 4 full-time doctors there, and there were no interns. So for me as a fourth-year medical student, it was a fantastic opportunity to be able to get involved, and with this level of skills that I have now, I was actually able to contribute as well. This is my preceptor, Dr. John Oakley, who's on the right there, and one of the what they call HEOs, which is equivalent to a nurse practitioner for us in Australia. And these guys were both fantastic. I learned a lot from them throughout my rotation. I chose to go to PNG because when I was thinking about where to go on electives, I actually initially didn't think about PNG, and I'm not even sure why I didn't think about PNG, and then I was talking to a friend who has a contact in the area, and I realised how little I know about PNG and how much more I wanted to know. On top of that, their health outcomes are very poor, and Tabubal as a town is reputed to be a very safe town, a good environment for someone for their first time in PNG. And there's a large caseload of very interesting medicine. I basically did 2 weeks of peds and neonatology, 1 week of obstetrics and gynecology, and 1 week of adult medicine. I'll just skip this in the interest of time, but I was doing mainly minor procedures, the same sorts of work that an intern would do in Australia. I've just got a photo of me examining one of my mates by the end of the 4 weeks there. He had tuberculosis, and it was amazing to see the response to treatment. These are some kids in one of the rural towns when we went out and did a camp out there, and it was one of the highlights of my trip was hanging out with the town kids. They were a lot of fun. This is one of the main the only road connection between Tabubal and Kiunga, which is further south in the province. And so that's, if anything comes into Tabubal, it's either via air on a very small airstrip or via that highway. My impressions of the place were that the care was much better than I expected, given the resources that were available and the amount of patients. Apparently they see something like 13,000 outpatients a month between 4 doctors, which is just phenomenal. The X-ray machine was very, very poor. You wouldn't even bother trying to get an X-ray in a kit most of the time. You couldn't interpret it. And from what I gather, there's only 2 CT scanners in the entire country. Compare that with where I'm from, which is Stanthorpe, a town of 5,000 people. We have a CT scanner, and we're half an hour away from Warwick's CT scanner, and then there's heaps of CT scanners at Toowoomba and Brisbane. Socially, I wasn't prepared for the difference between the people who were employed as mine workers versus the unemployed people who lived outside of the town. And culturally, I don't even want to speculate on what my thoughts were culturally, because it's just so complex. And unlike in India or where I've travelled in Europe, I found that the culture of the people I spoke to in PNG was so different to anything that I'd ever experienced that I couldn't really get my head around it in the space of a month. There are at least 5 Christian churches in town. I wasn't prepared for that. And there are also, what I wasn't aware of is how big the following for rugby league is in PNG. So I saw that many rugby league jerseys around town. It was a good opening of the conversation, actually. This was another one of my favourite patients. He had tuberculosis and he was severely malnourished when he first came into hospital. You'll see prescribed on his medication chart is actually 1 egg TDS, which is 3 times daily for his malnutrition, and that combined with the anti-tuberculosis medication brought him back to health. I was bribing him with some chocolates there. The Rotary funds went to a handbook which is universally known throughout Australia, known as Frank Shan's Drug Doses book. It's a tiny little book but very useful. And to therapeutic guidelines, which is a set of clinical guidelines for antibiotic prescription and also the cardiovascular therapeutic guidelines. With the extra $40 or $50 left over, I bought 2 tins of infant formula for one child who was born with HIV and very malnourished, and 1 bottle of intensive moisturiser for for a child with severe eczema. And this is with one of the HEOs in the hospital presenting him with the accident and emergency copy of the drug doses handbook. So I'd like to wrap this up by saying thank you for the funds that the club's been able to give me, both for my own expenses and to contribute to the hospitals where I went to. Without those funds, it's certain that I wouldn't have had the money to be able to undertake an elective like this, and the experience that I had was phenomenal. It's something which will stay with me forever, I think, and I'll be a much better clinician as a result of it. And with the funds that I was able to use to donate equipment to the hospitals, I think that made a great difference to the hospitals, and they were all very appreciative of that. So thank you very much.